Hi, and welcome to Legacy Insurance Brokers Medicare Enrollment 101 workshop, presented to you by Mike Tartarini and myself, Michelle Zaro. So here you can see our emails. So if you need to get in touch with us, thank you, Mike. There's mtartarini@lfsadvisors.com and mzaro@lfsadvisors.com. We're always here to answer your questions, so feel free to shoot us an email. So for our agenda today, we're going to be talking about Medicare Parts A through D. We're going to talk about the federal health insurance programs and private plans, your options, prescription drugs, medical supplemental insurance, and the next steps. Okay, Mike, take it away.
Thank you, Michelle. So again, Michelle introduced us. I'm Mike Tartarini, the other half of Legacy Insurance Brokers, and we're going to start talking about Medicare and all the parts about Medicare itself. This is an educational workshop for you. We are coming upon a very important time of year, the annual enrollment period, which starts October 15th. So our goal is to get you some information, basic education on Medicare, because there are a lot of moving parts and we want to just simplify this for you. At the end, we will take some questions and answer those questions at the end. So feel free to ask those questions when the question time arises. So again, we're going to start with the Medicare Parts A through D. And as you know, there's A, B, C, and D. And Part A is a part of original Medicare. I'm going to move myself around here. I apologize. I just don't want you to see the screen. Part A covers hospital care, covers hospital insurance. Part B is medical care, covers medical insurance, doctor's visits, things like that. Parts A and B combine and make up original Medicare, and they are administered by the federal government. Okay, Medicare is health insurance for people over 65 or under 65 with certain disabilities. Then there's Part C, okay, and I'm sure you've heard a lot about this recently with the advertisements that are on TV, on the radio, everywhere. Part C is called Medicare Advantage. Okay, you can buy Part C from private insurance companies, and it combines Parts A and B, which is original Medicare, may even offer drug prescription coverages, and it includes additional benefits, and we'll get into those additional benefits as we go. You can buy a Medicare Advantage plan if you are enrolled in Parts A and B and you live in the plan service area, and how that is calculated is by the plan service area. It's the zip code that you will go by to see if the plan that you are looking to enroll in will accept you regarding your zip code. Okay, you know, there's sometimes people think it's by town or state. It isn't. It literally goes by a zip code. And then there's Part D. Okay, Part D is part of the prescription drug coverages, and it's only offered through private insurance companies. Now, again, I'm going to move myself here. I apologize moving around like this, but so what we've got here are Parts A, Parts B, which are the original Medicare parts. There's Part C, Medicare Advantage plans, and these typically include Parts A, not typically, always include at least Parts A and B, and often Parts D, which prescription drug coverage is included. And then there's Part D, which sometimes can be held as a separate plan itself. Okay. Now, federal health insurance programs and private plans. Why can't I just rely on Parts A and B, what the government pays for? Great question. You can, but generally it only covers 80% of your Medicare approved healthcare costs. It covers hospitals and doctor visits along with some drugs, but that 20% gap could be very substantial for you, for you if you have a surgery that's required or some year where this, you know, you're in and out of the doctors a lot for certain ailments. That is something that you do not want to get stuck with, is a 20% gap in coverage. Okay. Now,
and, 1 second. So when you go back, with some drugs this does not mean that it covers prescription drugs. So a lot of people get confused when they see that Part B covers some drugs. They think, oh, I don't need a prescription drug plan because I got Part B and it covers some drugs. No, it's not like that at all.
Very limited.
These might be like drugs for, let's say you're in the hospital and they have to give you something or something like that. It's not your prescription drugs.
Right. It's not a prescription drug plan, as Michelle mentioned. Great point. It's very limited. And a lot of the times the drugs that you may need are not covered. So you're usually not covered more than you would be covered. And that's why the additional coverage is very important. Great point, Michelle. Thank you. And as we go along, Michelle and I are going to jump back and forth here, which is great. So we can kind of work off of each other, give you the best of both worlds regarding all the coverage and information you need. Now, when you choose a Medicare Advantage plan, Part C, as we said earlier, the plan will cover Parts A and B and all the same benefits as original Medicare and sometimes extra benefits. Like hearing, believe it or not, vision, dental care, home health care, and then there's additional coverages for gym memberships, things like that. And then the prescription drug coverage is usually part of the plan itself in most of these Medicare Advantage plans today. There's also a yearly limit on out-of-pocket costs for covered medical services. So what that does is it actually caps the cost to you if you've had a bad year going in and out and paying co-payments, things like that. You're not going to pay over a certain amount, so you don't end up in financial crisis. So you are protected on that end as well. Now, what's the bottom line? Well, Part C or Medicare Advantage, it combines Parts A and B, as I mentioned, and usually Part D all in one plan. So it's a consolidated plan. There are many choices in the marketplace, and we can help you weigh your options. All the major carriers offer them, so a lot of the names you're familiar with. I'm sure plans, companies that you've owned in the last, previously, whether it's individual insurance that you have yourself, you paid for, or for an employer type subsidized plan. All those major carriers usually are part of the Medicare Advantage plan market. Now, your options, how to decide which Medicare option is best for you. Now, this is an individual decision. Obviously, you consult with your spouse or your significant other or family member, but individually, these plans are actually chosen and picked for you and yourself. When you decide on this, this isn't a combined thing. It's not like a family medical plan or a spousal plan. So what you need to do is make sure the plan you're picking is best for you, not for you and your spouse, but for you, just so you know. So it's, and your spouse may have different medical needs than you, and that is when you decide. There could be two completely different plans that you both decide upon, which is okay. Now, questions to consider when choosing your Medicare options. What monthly plan premium can I afford? Is cash flow an issue? Does the plan cover the services I need? Okay, so if you need a specialist and you've got some issues, a heart doctor that you really need, make sure that doctor's in that plan or the services that you need or are required. Can I see the doctors I want? Are they in my network? Does the plan I want have the doctors and the hospitals in that plan to make sure that I'm covered and that I'm making sure that I'm taking full advantage of that plan and the services they provide? Now, what about drug prescription? Obviously, prescriptions are covered in a lot of these Medicare Advantage plans, but will my prescription drugs be covered? So you give us a certain list of drugs, we'll do the research for you to make sure. That's another thing that's very important. Make sure that the drugs are covered. They're in that, obviously in the network, and that your co-payment or the coverage that you're looking for is there and is affordable. Now, what will my out-of-pocket costs be? Of course, that's something you need to be concerned about regarding situations down the road that you're not ready to even understand or know what's happening, because we can't predict the future. Can I use the pharmacies that I want? A lot of these plans actually let you go outside a network regarding pharmacies, but they do have relationships with certain pharmacies, and what that does, it keeps the cost down for you from a co-pay standpoint as well. Okay, and we'll help you with that as when looking and researching for you. Now, either option, you have two paths to choose. Either original Medicare, okay, and you'll get Part A, Part B, and then a supplement insurance plan, and then Part D, a separate drug plan. Okay, that's one option. Now I'm going to move myself over here. Then you have another option, Medicare Advantage, which combines Parts A, Parts B, and Parts D. So again, it's kind of a consolidated plan where you don't have to go outside to get additional drug coverage. It's all in one, which sometimes is nice and convenient, but sometimes the supplement route is the way to go. And I will get more to detail with that as we go further. Now, why, if you choose a Medicare Advantage plan, here are your options, okay? They offer both HMOs, health maintenance organizations, and PPOs, preferred provider organizations, okay? Now, let's take a look at a PPO. You can use doctors and hospitals outside of the network, but often for a higher copayment, okay? A preferred provider organization. You will be covered, but again, if they're outside the network, you will pay a little bit of a copay. But if they accept Medicare, most of the time they will accept you and help, obviously, with the services that are needed.
And a lot of times you don't need a referral when you have a PPO. A lot of them don't expect that. So you
Great
just
point.
have to expect that you might have a higher copayment.
Right. Well, yeah, right. But if they're in network, Michelle, great point. As she said, PPO, it is a little more convenient. So if you had a doctor or your primary care doctor and you wanted to see a specialist, and say the specialist was at a certain hospital that you really liked, and the specialist is in network, but it's not part of the primary care practice or their referral system, you can use that doctor, which is something you don't need a referral to go and see. So that's an advantage. Thank you, Michelle. Great point. Now, original Medicare Advantage costs, this is just talking, right now about Part A deductible insurance, skilled nursing facilities, Part B annual deductible, and 20% co-insurance with Part B. This is what a Medicare Advantage plan covers. All these gaps here for you, okay? So make sure that's something you're aware of, and that's a nice addition to that original Medicare piece. Now, as I mentioned, it also covers, some additional benefits, and one of them that we didn't mention earlier is a lot of them do cover emergency medical care outside the United States. So if you're traveling and you're overseas in, say, Europe or something, you have a planned trip, emergency medical care services are covered outside the United States in a lot of these plans, and also nationwide. A lot of them do cover you nationwide. There's annual hearing exams, eyewear and hearing aids. We talked about prescription drugs, and the limit on the out-of-pocket annual cost is nice too, because again, it's capped where it's not going to be financially catastrophic for you if you have a bad year. Now, prescription drugs, okay? Let's look at Part D, the drug plan. Okay, here's how Part D works. You buy this in addition to Parts A and B, and this is not going with the Medicare Advantage route. This is going the Medicare Supplement route with original Medicare, okay? You'll have Parts A and B, and then you'll have to add a standalone prescription drug plan. Okay, with Medicare Advantage, the prescription drugs is actually included. Okay. Now, this is just prescription drug coverage, how it works. This is back in 2019. It's very similar to this day as well. Part 1, stage is deductible. You may pay full discounted costs, which is usually the case, especially if you have the coverage. Part D is stage 2, initial coverage. If you stay in the initial coverage stage until the combined amount, then you included deductibles reach a certain amount, and everything is going to be covered. Part 3 is a coverage gap. It's very similar. And Part 4, stage 4, I should say, is where if you have a real catastrophic year regarding drug prescription coverages that are needed, you're going to pay $3.40 for generics, $8.50 for brand amount after. Okay, this is Part D, after you reach the $5,100 max, whichever is greater. But a lot of the times you'll never get to that number. A lot of these plans do cover you in a really good amount of coverage, again, whether these are individual prescription drug plans or even part of the Medicare Advantage plans.
And these numbers that you're seeing on the screen, as you can see, it does say 2019. So don't think that this is the cost right now.
Right. This is just an example for you. Exactly, Michelle. Now, formulary. This is based on the most commonly used Medicare drugs, prescription drugs. The formulary may change at any time. But we will help you with that. Like I said, it depends on what plan you're looking to get into. Michelle and I can research the drugs and to see what kind of coverages are out there and if they are covered. Now, I mentioned supplement plans earlier, Medicare supplement insurance, and nationwide they're called Medigap insurance plans. Okay, we're going to touch on that. Sometimes, like I just said, it's called Medigap. You may want to consider this if you choose original Medicare. It helps cover the gaps of what original Medicare covers. But the good part about it is you won't have co-pays or co-insurance or deductibles, but you will be paying a premium for it per month. Okay. And Medigap plans are health insurance. Again, they're covered. They are provided by private insurance companies. Medicare, Medicare supplement plans actually help cover medical benefit gaps, but they do not include Part D or prescription drugs. So that's where you would have to add an additional Part D prescription drug plan, okay, if you were to go the supplement route. They do cover visits to any doctor who accepts Medicare, so you don't need a referral. There isn't really a network as long as the doctor or the facility accepts Medicare you will be accepted and receive that help from the doctor. Okay. Now, next steps, bringing it all together. Okay. Step one, enroll in Medicare Part A and B when you're first eligible. Okay, that's step one before you can make any of those additions into these Part A and B. Step two, okay, now you have two ways to proceed. Option one, you can keep original Medicare, add a Medicare supplement plan with a premium and a Medicare Part D prescription drug plan with a premium. And also your other option is to get a Medicare Advantage plan. Okay, this combines both A and B and Part D. Now, so I'll go back to this slide quickly. The difference is original Medicare and a supplement plan will have, you'll have a premium. You'll have to pay for Part B no matter which one you choose, whether it's a supplement plan or Medicare Advantage plan. But the supplement plan, you will be required to pay an additional premium. The Medicare Advantage, usually there isn't an additional premium, but you will have co-payments. Okay, that's something that will be different from the Medicare supplement plan.
So people typically that like the supplement plans are those that like to, they want to know exactly how much they're going to spend every month. They don't want to have to worry about like co-payments and stuff like that. So if you have the money and you have a lot of health conditions, then that is definitely a great way to go. If you want to be right on top of exactly how much it's going to cost you.
Yeah, again, each individual situation is different. Like Michelle mentioned, Medicare supplement may be the best move for you depending on your needs. Like Michelle said, you don't have co-payments, but you have a premium. You don't get prescription drug coverage. You have to get a separate drug plan and you have a premium, but some people like that. And like I said, it's accepted anywhere original Medicare is accepted. The Medicare Advantage plan, usually want to make sure the doctors and hospitals are in the network to keep your costs down. But again, there's max out-of-pocket cost there, so you're not going to get hit with a catastrophic situation either. So it really depends on what your needs are. Both are very good. So it's like I said, it's an individual choice. Okay. Now that I understand my Medicare options, when can I enroll? Okay, let me get me out of here again. Here, I apologize. I'm all over the place. So Part A, Part B. How do I enroll Part A, Part B? If you are getting Social Security when you turn 65, you'll automatically be enrolled. If you're not getting Social Security when you turn 65, you'll need to sign up for Parts A and B. And you make sure you contact Social Security 3 months before you turn 65, okay? That's key because you don't want to have a lapse in coverage if you plan on getting on Medicare, okay? Now, people that are on Social Security disability will automatically be enrolled, in the 25th month of disability. So remember that, okay? Now, when can I enroll in a Part C and D plan? It's the same 7-month window as Part B. It includes the 3 months prior to your 65th birthday and 3 months after. Those are the timeframes you can enroll when you're turning 65, okay? Now, are there other times that I can enroll in Part C and D? Yes. So like I mentioned earlier, annual enrollment period is coming up. Actually, in about 3 days or so, it starts. So October 15th through December 7th is when people with Medicare can change their health plans. You can switch to a Medicare Advantage plan. During this enrollment period, join a Medicare prescription drug plan, or even change the plan to another plan that you're currently in, okay? Now, you can also enroll in Part C and D during a special enrollment period for special circumstances, such as losing your employer coverage, retiring, moving to a new service area, or if you have extra help and you need extra help, okay? Now, what if I'm late signing up for Part D? Same with Part B. If you're late for signing up for these parts and you haven't had credible coverage, if you have credible coverage, it's okay. There won't be a penalty. But if you don't, you may face a late enrollment period. It increases based on each month that you delay, and this can get really costly. So just please make sure that you are aware of the time frame where you can sign up.
And it does not go away.
Correct. Thank you, Michelle. Now, this is when can I enroll in a Medicare supplement Medigap plan? It has a 6-month open enrollment period. It automatically starts the month you're 65 and enrolled in Part B. For example, if you turn 65 on April 5th, but don't join Medicare B until May 27th, your Medigap open enrollment period will start on June 1st. This is the first day of the month in which you are 65 and enrolled in Part B. During your 6-month open enrollment period, you can buy any Medigap policy sold in your state. Okay. Again, something Michelle and I can help you with. and look at the plans that are offered in the states that you live in. Now, what if I have health problems? Okay, during the 6-month open enrollment period, you can purchase a Medigap policy even if you have pre-existing conditions. Okay, even if you have a disability or health problems, an insurance company cannot do any of the following: refuse to sell you a Medigap or Medicare supplement or Advantage plan, charge you higher premium than they change others who are, than they charge others who are 65 and older, and they can't delay the start of your coverage either. Okay. What if I delay enrollment? You can apply for Medigap policy, Medicare supplement, after your open enrollment period ends. However, there's no guarantee your application will be accepted if you don't meet medical underwriting requirements, except in certain limited situations. In Massachusetts, I think a lot of that is something that would be accepted, except there isn't a medical requirement. But again, we don't want to be late to signing up for any of these plans because there could be issues down the road regarding the original Medicare side of it. If you're able to buy a Medigap policy, there may be an additional cost in the form of a penalty, as I mentioned. So you don't want to wait and get hit with those penalties, okay? Now, important dates and instructions. Enroll in a Medicare plan during the annual enrollment period, October 15th to December 7th. This is if you're already in Medicare, an Advantage plan or a supplement plan or original Medicare. Talk to us. We can help you decide if that's still the right plan for you. A lot of the times it is. People just roll right into the next year, and it usually automatically happens if you're on a plan that you like. It'll usually just roll right into the next year. If you think there might be some better options out there, Michelle and I can do some research and sit with you and see what your needs are. And if there are, we can sit down and look at a number of plans for you and help you decide on which might be the best move at that time. Okay. Now, if you have any questions, we would love to take them, and we will answer them in order. And at this point, we just want to talk about some quick information here as the questions will be rolling in. Please contact us directly with any questions or to schedule an appointment, or right in Westborough, Massachusetts. You can call us at 800-427-9781, or as Michelle mentioned earlier, our email addresses are there. If a phone call you're more comfortable with, or a webinar like this one-on-one we can do, or we can visit you in person if you feel safe enough, and the COVID, if you're vaccinated and you'll require masks, which is fine, we can do all that. You can come into our office here. We have a big conference room, and we can provide social distancing, masks, and all the requirements needed to protect you. Again, we can do this old-fashioned way via phone call. So whatever works for you, we're very flexible about that. Michelle and I book a lot of appointments, and we are on the road, we're in the office, and we'll accommodate you. We really appreciate your time. Thank you so much. And please reach out to us for any questions. Again, we'll help you, educate you, take the stress off of this Medicare decision, because it's a very, very big decision, very important decision. And our job is to make this simple and less stressful.
And I just one last thing. I just want to say that I know I know that it's something that you can do yourself. You can go online, you can look at the stuff, and you can sign up yourself. And I've heard people that have done it. But I just want to point out that even though you can do that, it's still really good to talk to somebody, because you might be missing something. Mike, I just had my mother-in-law who thought she had the best plan. She's like, what do people need you for? And I said, well, she's like, I signed up for myself. And I said, okay, so do you have this? Do you have that? Do you have, and she's like, well, no, I don't have any of that stuff. So I said, well, see, that's why it's good to talk to somebody, because we've done we have to test for all this. We have to look into stuff. We know what we're looking at. So, and it doesn't cost you anything. We're not going to charge you to talk to us. So we're just here to help.
Great point, Michelle. And Michelle made a great point. So, we are certified. We do have to take a test every year to make sure that we are certified to offer certain Medicare plans. As Michelle mentioned, this is 100%, free consultation, complimentary. There's no obligation whatsoever. We don't, this isn't high pressure sales. This is just educational, and we will provide you with all the tools necessary to make that decision. And that being said, as Michelle mentioned, we do come across situations where people think they're in the best plan possible, whether it's their employer plan or, original Medicare. We had a gentleman that had original Medicare only and ended up needing major heart surgery and was on the hook. It was $1 million when it was all said and done for hospital bills. And, Medicare originally covered, as we mentioned earlier, 80%. So he was on the hook for 20%, $200,000. It's a lot of money. So we want to make sure that you're aware of that, that, you really make sure that all your ducks are in a row and that you are looking at this prior to when it's time to sign up. So you're not making a hasty last minute decision. Have all the knowledge, all the information, literally, weeks prior or months prior. And then when the time comes to, pull the trigger, you're ready to go and you feel comfortable with that decision. Thank you again for joining us.
Yeah.
We will take questions now and we will answer them in the order. Appreciate it.
Thank you.